Hello and welcome to another anatomy video brought to you by the floating hands with the help of a pen. On today's topic, the common iliac arteries. These guys are the terminal branches of the abdominal aorta, which has a lot of other arteries originating from it, so if you want to see something you can't find here, please consult those previous videos in the playlist. Okay, so the common iliac artery, straight to the topic. This guy divides into two main trunks, the external and the internal iliac artery. The external iliac artery, with two very small exceptions, supplies blood only to the lower limb. And we won't discuss it today. Now, to be honest, I was not planning to make a video on the external iliac artery and so on, because, how to put it, this was very difficult for me to draw, and drawing the entire lower limb with all the muscle layers and all the compartments is way out of my league. If you would like to watch something a bit more schematic, just write it down so I know you would like it and I can make it happen. Now, let's focus on the internal iliac artery. The internal iliac artery, after its origin, would split into two main divisions, the posterior and the anterior division. You can check out the anterior division, quite profuse branching for different organs as you can see, while the posterior division, you can't really see any organ branches. That's why, if you have to summarize it, anterior division is mainly visceral and has some parietal muscular branches, while the posterior division supplies only muscles with and a little bit of the spinal cord nerves and spinal cord, or at least terminal portion. Okay, so let's go and dive deeper into each one of those, into the theory behind each one of those guys. And let's start first with the posterior branch. So along the length, you would see two main arteries originating from it, and these are the iliolumbar artery and the sacral artery. The iliolumbar, after its origin, it's very short, and on your dissection you would find it very hard because it's kind of squished behind the artery and almost completely behind the psoas muscle. So if you can find it in this small crevice around the psoas muscle, you would see that it would split straight away into two major subdivisions. One of them passes transversely behind the psoas muscle and branches in the iliac muscle, and that's the iliac branch, as the name implies, right? In the iliac muscle. And the other one goes to the lumbar region and as well would be named the lumbar branch. This lumbar branch would give you one small artery, which I've named with 7' here, and this 7' is the spinal branch. So this iliolumbar artery would supply blood to the cauda equina, which is the terminal most portion of, well, not the spinal cord, but the spinal cord nerve roots, right? Now, next on the line is the sacral artery. There are usually two. If it's one, it would split in two very fast. So the sacral artery is divided into the superior and inferior sacral arteries, which can be separate branches, as I said. And the superior sacral artery usually goes through the second foramen, supplies again the spinal cord nerves there, and goes to the back of the sacral bone, where it would supply the skin on the backside. While the inferior sacral artery goes along the length of the sacral bone over the spinal nerves, and it supplies them with a little bit of the bone, etc., with blood. Now, I did say these guard the spinal nerves. Just a short overview. The yellow thing is called the sacral plexus. The sacral plexus is made from the ventral branches of S4, S3, S2, S1 and L5 ventral branches of the spinal cord nerves. A separate video on that is planned, so you can consult it when it's done. And this plate where they fuse is known as the sacral plexus. So it's drawn here because all of the arteries have some relations to it, as you saw with the lateral sacral. The last terminal division of the posterior trunk, the posterior division, is the superior gluteal artery. This one slips usually in between L5, S1. It can go between S2, S1 as well, but doesn't really matter. So after it goes behind these nerves here, it would go behind the piriform muscle, which is on the background here, and exit on the back side. We'll see what will happen with it a little bit later. And that's pretty much it about your posterior division. So, and this again is a not mainly, but it's a muscular branch for the gluteal muscles. Next in line, the anterior division. The anterior division is very variable in its branching pattern, but usually the first two arteries are the obturator artery and the umbilical artery, sorry. So the obturator artery goes through the obturator foramen, which is a hole in the internal external parietal muscles, passes straight underneath the pubic branch of the bone, as you're going to see in your dissection, and goes down towards the lower limb. If you're dissecting the lower limb, you would find it in between the medial muscle group where it would supply those muscles. Next, as I said, the umbilical artery. The umbilical artery is kind of an artery only up until here-ish. The rest of the artery is closed up. It has obliterated, so it's basically a connective tissue cord. But the first part is still opened up, it still has some blood flowing through it, and it's important. The entire thing is important for the embryonic and fetal development, as you might imagine, right? The umbilical artery. And from the part that's still usable, that's still traversable, you have several small branches going towards the bladder that originate from this area, and these are the so-called superior vesical branches, or arteries, sorry. So, as the name implies, if you have superior, you have inferior, right? So you have a group of inferior branches, inferior vesical branches, which are coming in different ways that we're going to see in a second. So those are the first two guys. Then the direct continuation of the trunk of the posterior division would be the internal pudendal and the inferior gluteal. Similar to the superior gluteal, the inferior gluteal would pass in between the ventral spinal cord nerves, and usually in between S4 and S3, and again would appear behind, underneath the psoas, underneath the piriform muscle, opposite to the superior gluteal artery. So you have these two superior and inferior gluteal arteries here from the different trunks. Then the internal pudendal artery is kind of hard to explain, to be honest. It has a very particular trajectory. So it starts from the posterior division, from the anterior division, runs over the plate here, then passes behind a ligament, which, if you remember your osteology and your joints and ligaments sessions, if you had such already, is a connective tissue bundle which spans in between the sacral bone, and in this area somewhere you would find the ischial spine. So this sacrospinal ligament would cover the artery here, so the artery goes behind it, then it loops around it and comes back in the pelvis, and then it goes towards the perineum and the pudendal region, where it would give a lot of outbranching arteries. Again, quite hard to explain, very long, so if you want a more in-depth explanation for this guy, just write me in the comments and I will make it happen. Along the length of the internal pudendal arteries, several small branches would appear, and these are the inferior rectal arteries. Above the inferior rectal arteries, an outbranching of the trunk is also the medial rectal artery. Right? So you have inferior, you have medial, which means you might have superior somewhere, and if you remember, those superior rectal arteries were coming from the inferior mesenteric artery. Again, consult the other video if you are interested in that. Okay, so these are the main arterial branches. So you have branches for the rectum, branches for the bladder, and if you're a woman, you would probably have a vagina, so you'd have a vaginal branch, and from the vaginal branch, usually several small inferior vesical arteries arise. Of course, if you're a woman, not only a vagina would be present, but you would have an uterus somewhere around here between the rectum and the bladder, so you would have also the uterine branch. Of course, if you're not a woman, the vaginal branch won't be present, and these inferior vesical arteries, yes, can be a direct outbranching of the trunk itself. Also, if you are a man, you probably have a prostate, so you would have a prostatic branch, etc., if you get the idea. From the uterine branch, you would get also tuber branch for the fallopian tubes, you would get ovarian branch from the ovaries, and basically an arterial vessel for every single organ, in short. Now, what happens with the gluteal arteries when they go around the piriform muscle? So you do know that behind the gluteal muscles, now during your dissections, if you cut through, or prosections depending on what you're doing, if you cut through the gluteal muscle and you open it up, underneath that you would see a opening, and over that opening would lie one single muscle, and that muscle is called the piriformis muscle. So this opening is located in between the sacral bone and the pelvis, and these ligaments here, and it's called the major, this ligament here to be more precise, is called the major sciatic foramen. So this major sciatic foramen is traversed by the piriform muscle, and that splits it into a superior and inferior, suprapiriform and infrapiriform openings or foramens. The superior gluteal artery goes through the suprapiriform, and the inferior gluteal artery goes through the infrapiriform foramen. As the name implies, right? Not very difficult. Now, the superior gluteal artery is kind of fiddly with its branches. These guys supply the gluteal muscles mostly. So the superior one would divide into a superficial branch, which goes into the most superficial gluteal muscle, which is the gluteus maximus muscle, and then into a deep branch, which is located in between the bone and the gluteus medius muscle, and it's called the deep branch. If I didn't say the name, I don't remember, to be honest. So this deep branch would bifurcate into a ascending and descending branches as well, and these guys would supply the gluteal musculature with the help of this one here. Now, these many branches here are important, to be honest, for some anastomosis with the inferior gluteal artery, with epigastric arteries, not epigastric, some deep arteries, which is called the circumflex ilium profunda, but in general, I wouldn't consider these anastomosing branches very important, so we're not going to cover those things here unless you need them. Again, if you need that, drop a comment down below so I know what I can do to make myself more useful along with these videos. Okay, that's pretty much it as far as the anatomy goes. Now, you know that I try to give you some perspective on the clinical point, and usually some very niche, sometimes symptoms or syndromes which can happen due to the anatomy of the region, but here, to be honest, I'm not aware of anything that interesting. Just during blunt trauma, let's say during pelvic fractures or during pelvic surgeries, as a surgeon, I suppose you should be quite aware of all of these guys here, so you know where and where not to cut, right? One important thing, if you have a pelvic trauma that could be accompanied with severe bleeding, and let's say if you have a rupture of the vessel down here or down here, it's very hard to find it in the pelvis because it's a very small cramped space. So you can do beforehand a ligature, kind of a clamp in the common trunk, which is the internal gluteal, not gluteal, the internal iliac artery, right? So you can stop the bleeding, so you can have a clearer field of view. So What's important to know here is that this bifurcation happens usually at the level of S1, L5, so you can, at least the surgeon can locate it quickly based on these correlations. The other more interesting thing that I can give you here as a piece of information is this blue variable vessel here, which I've marked with nota bene, and it's called corona mortis, or the crown of death, which is a very poetic name, as you can see. So what's that? That's basically a variation where the obturator artery does not come from here, from the internal, but comes from the external. And since the external is just over the pudendal bone, the artery still needs to go to the obturator foramen, so it would wrap around the branch of the pudendal bone very tightly. So if you see it during a dissection, if you're lucky, you would basically find the pudendal bone and an arterial branch which goes very closely and loops around it like that. Now, in general, when arterial branches are so close to bony surfaces, it's not bad if everything's okay, but during fractures, you know that fractured bone fragments can be quite sharp, and sharp things near arteries are usually not the best combination of events. So during pelvic fractures, yes, this guy can break, and yes, this guy can rupture the artery here, and that usually leads to severe bleeding. And at the time, during some pelvic surgeries was quite often nicked because it's at a place you don't expect it, right? Hence the crown of death. To be honest, I don't know how deadly it was, but I suppose it wasn't a very pleasant trauma to find. Okay, so that's pretty much it on the internal iliac artery. If you have some particular requests, again, drop them in the comments down below. Like the video if you found it useful. If you don't, dislike it. Just give me some feedback so I can make it better next time. I hope it was a useful and productive one. So enjoy your day and goodbye.